Okay, so it's time for our third talk now. And while I start introducing Brian, he's going to be switching on his camera and his microphone and his presentation ready. So earlier on, I spoke a little bit about brain health when it comes to Terry Pratchett. And Brian is going to return to this subject as someone who's much more informed about it than I am. Brian is of old age psychiatry at Trinity College and Deputy Executive Director of the Global Brain Health Institute at Trinity and University of California, San Francisco. He has been involved in the care of people with dementia for over 30 years, during which time he's carried out national and international research into the diagnosis, treatment, and prevention of Alzheimer's disease. And today he's going to speak about Terry Pratchett, Alzheimer's disease and hope. Okay, thanks so much.
Thanks very much, James. And it's a pleasure and delight to be here tonight to meet you and to talk with you. Before I start, I was just struck by Roisin's talk. I'm a newcomer to Discworld, really. And I was struck by how important it is to try something new. And I was thinking about the benefits of a convention for brain health, all the good things that a convention can do for your brain health. For example, it sounds like a convention builds a lot of social connection. And of course, loneliness is bad for your brain health, whereas social connection is very good for your brain health. Music is very good for your brain, as is drama and creativity. All these things happen at a convention. Exercise, swordplay, aerobic exercise is very good for your brain health. Quizzes are very cognitive stimulating. Again, protect your brain health. Alcohol, light to moderate alcohol in moderation, as I hear happens at these conventions, also is good for your brain health. And then also the intergenerational benefits. Children, adults, older people meeting together. This is all very, very good for connection, but also for brain health. So it sounds to me like these conventions are potentially of great benefit for brain health. I was also struck by the fact that the Alzheimer's Society of Ireland works with Roisin and the group, and I just wonder, maybe perhaps when we come to questions and answers, we might talk about this, but whether there's been any co-creation of some of these convention activities with people with dementia. It could be very, very interesting. So food for thought. Now, I'm going to tell you a little bit about the links between Terry Pratchett, Alzheimer's disease, and hope. And I feel that Terry Pratchett was a wonderful advocate for people with Alzheimer's disease, and he was a very strong voice of hope for people suffering with this illness. Because this illness is often cloaked with a lot of fear and a lot of anxiety. And this is a World Alzheimer Month, and the hashtag is Let's Talk About Dementia. And this is exactly what Terry Pratchett did. When he developed Alzheimer's disease, he talked about it. He talked about dementia. And I think this was one of the reasons why he was able to generate a lot of hope around the condition. I was very lucky, very privileged. About 10 years ago, November 2010, when Terry Pratchett gave his inaugural lecture in Trinity College, Dublin, when he became an adjunct professor in the School of English. A number of us were invited to lunch with him in a restaurant there in Trinity. And I've a wonderful, wonderful recollection of the conversation at the lunch table. And really what struck me was his openness and his willingness to talk about his illness, how it affected him, and most importantly, how he was dealing with it and what he was going to do about it. At that stage in 2010, he was 3 years after the diagnosis of posterior cortical atrophy, which is a rare and unusual variant or form of Alzheimer's disease. So let me tell you a little bit about posterior cortical atrophy, or what's also referred to as the visual variant of Alzheimer's disease, because this is what Terry Pratchett had. Age 59 in 2007, this was the diagnosis. He presented with a number of different problems: spelling, typing difficulties, judging space and distance. Initially, it was thought to be a small stroke, and this is not unusual with this condition. When somebody presents at a young age in their 50s with these types of symptoms, doctors often think it could be a stroke, or because there are very prominent visual symptoms, they may think it's an eye problem. So there can be a long delay in terms of getting the diagnosis. And for these earlier young onset dementias or atypical or young onset Alzheimer's disease, it can take sometimes up to 4 years to make a diagnosis. Terry subsequently had an MRI and more detailed neuropsychological testing, and at that point, the diagnosis of posterior cortical atrophy was made. Just to tell you a little bit about the condition, because it is a rare variant of Alzheimer's disease, I'm just showing you here some MRIs, and on the top you see a healthy brain. We're looking at the brain from the side. Down here on the left is the brain of a person with more typical Alzheimer's disease. Alzheimer's disease usually presents with short-term memory loss because the pathology of Alzheimer's disease usually begins in a part of the brain called the hippocampus and the medial temporal lobe. These are deep over the ear, deep in the brain over the ear. So people with typical Alzheimer's disease will short-term memory loss, which gets progressively worse over time. And then they will develop language difficulties. And they may have some visual spatial problems, but these are usually at the middle or later stages of the disease. But what happens in the visual variant of Alzheimer's disease, or posterior cortical atrophy, PCA, you can see that the shrinkage or atrophy is in the back part of the brain. We call primarily the occipital and the parietal lobes, but you can see here very prominent shrinkage back here. And this is why this form of Alzheimer's disease presents primarily with visual type symptoms, as Terry had difficulties with spelling, with writing, with reading. Normally when you test people for Alzheimer's disease, you're looking at memory deficits and you're using very detailed memory testing. But in this form of Alzheimer's disease, memory, short-term, is relatively intact, particularly in the earlier middle stages of the disease. But what you see are prominent difficulties with copying. And what I'm showing you here is the attempts of an individual with posterior cortical atrophy to copy a square or copy intersecting pentagons, and here to draw a clock and put the numbers in. So the problem is not with vision. Vision is usually 20/20. The problem is with the processing of images at the back part of the brain, in the occipital lobe. And this is why people with posterior cortical atrophy, or this visual variant of Alzheimer's disease, present with visual difficulties. What I'm showing you here is a word salad. What I've pulled together here is a word cloud of the different types of symptoms or behaviors that somebody with posterior cortical atrophy might have. But it really represents what somebody with PCA might actually see when they're looking at a page. Lots of words mixed up, jumbled about, having difficulty making sense. Now, what I'm showing you here is a video of what it is like for somebody with posterior cortical atrophy to look at an image of Brighton Pier. So that gives you a real sense of what we'd like to actually have posterior cortical atrophy. Difficulty when looking at images, with reading, with spelling, with writing. So just going back to Terry Pratchett, and he's spoken and he's written about this, his reaction to the initial diagnosis of Alzheimer's disease. What he felt initially was anger, a sense of loneliness, and a lot of fear. And of course, this is exactly what most people experience when they are given a diagnosis of Alzheimer's disease or of dementia. There's a great fear of Alzheimer's disease. Most people over the age of 50 would fear Alzheimer's disease or other forms of dementia far greater than cancer or stroke. So why is this a great sense of fear around the diagnosis of Alzheimer's disease? Again, Terry Pratchett talked about this. There is no cure for Alzheimer's disease. There are some treatments that can improve the symptoms for a period of time, but there are no treatments right now that can actually modify the disease, slow the progression. And when people think of Alzheimer's disease, they think of losing their identity, losing their autonomy, independence, and also their capacity. So there's a lot of fear and stigma around the illness. And this is a quote from Terry himself. People don't talk about it because it's so frightening. I swear that people think that if they say the word, they're summoning the demon. It used to be the same with cancer. And Pratchett, like many people, would say that Alzheimer's disease is where cancer was 40 years ago. If you think back, some of you may remember, cancer was referred to as big C. Doctors usually didn't disclose the diagnosis of cancer to individuals. They may have spoken to the family, but not to the individuals, because they felt that they wouldn't be able to handle. Cancer was seen as a kiss of death. There was huge stigma, and there was really no hope. Of course, that whole picture of cancer has been transformed because of the development of treatments and because driven primarily by research. So Terry Pratchett, over time, turned this loneliness, this rage, this anger into action and into a much more whole message. And what he did, which was difficult at the time, was he really started talking about what was uncomfortable, talking about dementia, talking about Alzheimer's disease. We do it much more now, but back then, when he was diagnosed, it wasn't that common that people came out and talked about it. And when he reflected with colleagues and they asked him, well, who should we tell that Alzheimer's disease, thinking that perhaps he should tell very few people, because that would be the natural reaction of most people when they get a diagnosis. His reaction was, tell everyone. And that's exactly what he did. He told everyone. He went on a mission to actually raise awareness, to talk about the uncomfortable, to tell everyone. This is because he believed that you had to tackle fear head on. You had to name the demon to kill it. Again, this is what happened with cancer over the last 40 years. When somebody's diagnosed with cancer now, people don't think, I'm going to die straight away. They think about what treatment is available. That's really where to get to with Alzheimer's disease. I want to talk a little bit about the constructs of fear, but the other side of fear, which is hope. Fear tends to paralyze people, but hope mobilizes. Again, quoting Terry Pratchett, welcome to fear. It's hope turned inside out. It's hope that's important, a big part of belief, hope. Hope is so important in Alzheimer's disease. And that's what we've been missing. I think this is what Terry Pratchett brought back. He changed the narrative. Hope is both an emotion and a way of thinking. a way of thinking and a feeling that there's a potential to secure a better future for yourself through your own agency, through your own efforts. So there is an emotional or a feeling part, which is about trust, care, and caring. But there's also an active part, will, which involves being motivated and having goals, and a way where there are pathways for action. And Pratchett had very specific goals in terms of where he wanted to get to with this diagnosis of Alzheimer's disease. And he had pathways for action, and he followed them. He changed the narrative, and my sense is hope was very key. He believed there were actions that we can take right now, that you can live well with dementia. Also, that everybody was different, everybody was unique. When you met one person with Alzheimer's disease, you met one person with Alzheimer's disease. And here you see him with the poster, "It's possible to live well with dementia and write bestsellers," which is exactly what he did, even though he had that condition. So hope is very powerful. It's very powerful from a therapeutic point of view. How does it help? Hope results in less anxiety. It has effects on the brain that mobilize motivation and agency. If you are hopeful, you tend to do better on tests and examinations. If you're hopeful, you're better able to adhere to medical therapies. There's very good examples, for example, with adolescents and diabetes. If they're hopeful, they're much better adherent to their medication and they do much better. Hope is a fundamental element in overcoming and coping and recuperating from illness, particularly illnesses such as cancer. And the same is true for dementia and Alzheimer's disease. So for the person who gets a diagnosis of Alzheimer's disease, having hope, and if the doctor can instill a degree of hope at around the time of disclosure, decrease anxiety and fear. It can also facilitate action. The person can follow through on treatment, on activities such as exercise, socialization, and engagement. And hope very much helps adaptation to the illness and facilitates participation. So hope is key to a better outcome for people with Alzheimer's disease. But there were other options and pathways that Pratchett followed. One of these was research. He believed in research, he believed in science. James said earlier on, and you heard him on the video, we need to get this thing out of our hair. We need to beat Alzheimer's disease. One other quote was that he said, the best research you can do is to talk to people. And I think what he meant by this is that it's important to engage people with the illness, with family members, in terms of the research you do. The research should have meaning for the person. You have to do discovery research, but you should also do research with people, for people. He also put it up to people that research should be done. And he gave $1 million to the Alzheimer Research Trust for research. That research actually was in basic discovery science, which is very important. Now, James alluded to this already when he was speaking. Research is important. Research funding is vital. And even though the numbers of people, the costs of Alzheimer's disease and dementia outstrips that of cancer, stroke, and heart disease, the amount of funding that's channeled into it is far, far less. 2% of medical research charity spending went to dementia research in 2016. In Ireland, dementia research is funded about 20% of what cancer is funded. That's not to say that cancer shouldn't be funded at that level or even more, but it's just that we need to fund dementia at a higher level if we're going to actually beat this demon. So research and funding of research is key. Essentially, you do get what you pay for. If you invest more in research, you get better outcomes. Research should focus on care, cause, and cure. Discovery research is important, but we also need to focus on research and care for people with the condition. Interprofessional and transdisciplinary research is key. So research between clinicians, basic scientists, but also bringing in creative life, humanities. We have to bring the professions together, break down the silos to tackle the condition. And public participation, the public patient voice, the voice of the person with dementia, the family members, is very important in defining the type of research that we fund and that we do. So what did Terry Pratchett teach us? I think he taught us a lot. He taught us how to talk about something that's very uncomfortable at the time, talk about dementia. He very much raised awareness around Alzheimer's disease. He called it out. He tackled the fear and stigma around this condition. I think he created a sense of hope around Alzheimer's disease. He showed a plan and a purpose and a pathway to action throughout his illness. He emphasized the importance of research as a pathway to hope. And I think very importantly, as a person, he was values driven. I was very interested in hearing Roisin talking about morality, equity. Equity is hugely important. But the values of courage and openness are powerful. And I think they were defining life values for him. He lived them. He walked the talk. I just want to finish on the Pratchett Project, which is connecting Pratchett, brain health, and neuroscience, as James said earlier. And it combines three of Trinity's great strengths. That's neuroscience, brain health, and language, culture, and humanities. And this is about getting this thing out of our hair. It's about tackling Alzheimer's disease. And it's about funding transdisciplinary research, funding cutting-edge research on the impact of a chemical messenger called noradrenaline on brain cell loss. This chemical messenger is very, very important for brain cell function. When there are problems with what's called the locus coeruleus, or the blue spot, which is a small nucleus in the midbrain, you can have brain inflammation, you could have nerve cell loss. In fact, it's believed that the locus coeruleus, the blue spot in the midbrain, is one of the first places that Alzheimer's disease can begin. So this project will fund cutting-edge research on the impact of this chemical messenger, noradrenaline, on brain cell loss. But very importantly, it will develop new and creative ways to look at neuroscience and share neuroscience research with the general public. As I said earlier, it's this transdisciplinary approach, breaking down the professional silos, bringing in humanities, brain health, and neuroscience working together is very much the way forward. So the Pratchett Project, we hope, will increase knowledge and awareness on Alzheimer's disease. We hope it will tackle stigma. We hope it will attract new research funding into this space, break down the professional silos, but most importantly, continue the work that Terry Pratchett began and commemorate him and continue to raise hope. Just before I finish, I'd just like to thank John Gillespie, because he's the individual, a Trinity graduate, who made a very generous philanthropic donation, which allowed us to fund the Pratchett Project. I want to thank Andrew Harkin from the Institute of Neuroscience. He's here in the audience, and I think he'll be happy to answer any of the tricky discovery science, basic science questions. And of course, James Hadley for leading this project and driving it forward. Thank you very much.
Thank you, Brian. It's amazing to hear you speaking in this about such a tricky subject, but so in such a the opposite of what I'm trying to do now, what I'm doing now, but in such a lucid and clear way. It's really inspiring. So can I just jump in with the questions, because there have been a few questions that have come from the audience, and the first one that came up is one that I'd actually really value an answer to as well, which is do people with PCA tend to find it generally easier to speak about their experience than sufferers of other forms of Alzheimer's?
I would say that people with PCA, because this disease, this variant begins in the back part of the brain, the front part of the brain remains relatively intact. So insight and awareness is relatively intact, certainly until the very late stages of the disease. So people with posterior cortical atrophy or the visual variant would have very good insight, good executive or planning function. Their short-term memory is relatively intact. And Terry Pratchett himself said, and he was told this, and he believed that it was a better form of Alzheimer's disease to have in many ways. But that's a general statement, because even in the more classical Alzheimer's disease, everybody is different. There is sort of there's a kind of there is a form. People are pretty much the same in terms of some of the patterns of deficits, but everybody is different. So if one person develops the illness and progresses in a particular way, another person may not go exactly the same way. And I think that's really, really important that people know that, because everybody's unique. Everybody can have different starting points. They may have different protective or risk factors, and even with the illness, things can pan out differently. But if the disease begins primarily in the back part of the brain and the front part is rather intact, so insight and awareness is more intact. But if in the more classical form of Alzheimer's disease, as the disease progresses, the frontal connections may be affected, so insight and awareness can be affected. So people may be less aware.
Okay, it's a complicated issue, I guess. And as you say, every patient, every person is different. Probably it's difficult to make generalizations about across the board. The next question is, I think, quite a difficult one to answer, which is what are the kinds of challenges to do with the co-creation of research between sufferers and their families? So I think it means like ethically, practically.
So there are challenges, but it's very, very necessary, because what you don't want to do is do research in a vacuum. So more and more it's realized that you must consult with people with the condition, with family members, to help inform the type of research that you do. Oftentimes family members and patients, people with a person with the illness, with Alzheimer's disease, particularly very early on, can be very helpful in terms of steering you in the right direction. Simple things like questionnaires or approaches that you might take. You could go down a rabbit hole, but be very quickly be told that's not going to work. Do it this way. It makes such a difference. So that kind of co-creation, co-design, that discussion early on can be very, very helpful, very, very informative, and it's a requirement now for all research in dementia and Alzheimer's disease, and quite rightly. Many of the charities, particularly the Alzheimer's Society of Ireland or the Alzheimer's Society UK, the Alzheimer's Association US, they will have what they call dementia working groups or advocacy groups or panels of individuals who give advice with support from advocates or family members. And almost invariably in research planning now, we would consult and look for advice. And do that at the very beginning, not just as a token, not bring somebody in at the end, but actually have it there at the beginning. And it can be incredibly helpful and very, very useful.
Excellent, thank you. And so the next question is, it's quite specific. Well, it's specific to Pratchett, but maybe it's just as much sense to speak in general. Lena asks, do you know whether Pratchett got help with his everyday dealing? For example, the prospect of trying to organize the images and perspectives of a book seems incredibly difficult from this perspective.
I think it's well known. I mean, Terry Pratchett had an assistant who was incredibly helpful and supportive to him, and was more than an assistant. Was I think a confidant and I think a wonderful friend. And we all need those types of people around us. And I think that's what that type of support is powerful in terms of life and potentially stabilizing the trajectory of an illness.
Oh, really? So, so the people around you can actually help the condition to slow. Is that?
Well,
Is that...
what I'm saying is that support, inclusion, engagement, all of those things can certainly benefit quality of life. And, it would be our view that, doing things, as I said at the outset, that are good for your brain health, we've no strong input, may help stabilize. We also know that there are bad things out there. For example, if you have a mix of medications where there are drug interactions, or if you get an infection and develop delirium, those things can accelerate decline. So the important message is, if you have a condition like Alzheimer's disease or dementia, there are things you can do. There are things you can do right now to try and improve your quality of life and to try and stabilize the condition. And there are things that that could destabilize your condition.
I see. And obviously you're saying that having people, a support network around you is one of those things that's very good to do. Okay, and so Sophie asks, what impact does PCA have on the communication of thoughts and ideas? Not the physical act of writing, but forming and describing stories and narratives that become much more, does that become much more difficult?
So when the illness starts at the back part of the brain, it's mostly about visual processing. And at that point, that's the executive functioning, the planning, the organization, the putting things together, that will still be relatively intact. But as the disease progresses, I mean, at the middle or later stages, that would become a problem.
I see.
A general statement, some individuals will have relatively pure and very, very prominent visual variant, and it may not progress anteriorly, frontwise, until the very late stages.
Annie asks a wonderful question, it's a gift of a question, which is, what do you think is the best way we can help raise awareness of Alzheimer's disease and PCA and brain health?
So is this to do with the conventions of Pratchett or just people in general? What's that?
In general.
Well, I think that I would say that I think if people can connect, with individuals who have dementia and recognize value and connect with them, I think that would be important. If everybody here tonight, made an effort to sort of with dementia over the next few weeks or months, that would be a great start. People, with dementia sometimes feel excluded, not valued. They tend to withdraw, and I think that's not good for their brain health. It's not good for their condition. And I think that reaching out and connecting and being available to support, I think would be would be a positive thing. I think it's about. I think it is about trying to create a society that's more inclusive of people with dementia. That that our environment and our society should adapt. It's not that the person with dementia should necessarily, or with Alzheimer's, it should adapt. We should make our environment and the way we interact and connect with people more dementia friendly, more dementia supportive, more dementia inclusive. And I think there's still a lot of stigma out there. There's still a lot of fear. People don't know what to do. How do you talk to somebody with? Can you really stay friends with a person with dementia, with Alzheimer's disease? Well, the answer is yes. But sometimes people don't know what to do or how to do it, and they're afraid, and then people lose their friends, and they lose their time when they need them most.
Dreadful, isn't it? When you think something like a stigma, it's based on probably people's fear of maybe the unknown, or fear of how. I mean, the condition itself is scary, but there's not really a reason. There's not a reason at all to back away. Exactly as you say, just when someone needs you. And so, at the beginning of your talk, you mentioned that you found the conventions quite inspiring as an idea, and I found it inspiring to hear Roisin saying how inclusive the conventions are when it comes to people with conditions that they identify themselves as having some condition, and then they don't have to say any more. I think this is just an amazing policy, and I was wondering if you could speak a little bit more about how this kind of organization or this kind of activity might be useful for people either with Alzheimer's or who know people with Alzheimer's.
Well, I was again, when I was listening to Roisin, I was just struck by again all the activities or behaviors which are all promoting brain health. Are good for your brain health. So there's a big emphasis right now on the potential to prevent Alzheimer's disease or prevent dementia. The idea is that if you do things early on, or certainly in midlife, you may be able to decrease the likelihood at a population level of developing Alzheimer's disease. So the belief is that there's about 30 to 40% of dementia, Alzheimer's disease has been the most common cause of dementia, but 30 to 40% are potentially preventable if you address a number of modifiable risk factors. So, for example, increasing levels of exercise, decreasing levels of obesity, treating hypertension or high blood pressure in midlife, treating high cholesterol, addressing loneliness and isolation, addressing age-related hearing loss, cutting down excessive or heavy alcohol consumption, protecting the brain from traumatic brain injuries. If all of these potentially modified risk factors were addressed, that you could decrease the number of people with Alzheimer's disease going forward about 30 to 40%. And there's some evidence already that this may be happening, because in the oldest old, the number of people with dementia are falling off, and this may be because of better cardiovascular health over the last 30, 40 years, and also because of better education. Education also is protected. So going back to the conventions, I mean, a lot of the things that are happening there, they're really positive. The social connection, exercise, intergenerational creativity, stimulating quizzes, the cognitive stimulating activities, the fun, the creativity. All of these things are potentially protective for your brain, and certainly good for your well-being. Music, So I just had a thought. That also it's such an inclusive approach that I could see how people with dementia, certainly perhaps at the with Alzheimer's disease early stages, mid stages, could benefit and be involved. And what a joy that would be, to look at that. I'd say Terry Pratchett would think that would be great fun, a great idea. And there are lots of creative interventions with people with dementia with Alzheimer's disease. Through the arts, through theatre, through music, which are showing benefit in terms of quality of life. So perhaps it's just a thought, and this is the benefit of bringing together. I mean, someone like me who knows very little or nothing. I know a little bit more now about Discworld. I know about conventions now in Steinman, and exposing me to that. That's really good for me, but also I think it's probably good for everybody to be exposed to something a little bit different because it just gives us new ideas.
Yeah, that's absolutely true. While you were speaking, I was thinking that most of the things, in fact, I think almost all the things that you listed off as being um, factors that might impact your brain health are behavioral, and also the kinds of things that we hear mentioned in relation to the lockdowns or semi-lockdowns that most people in the world are living in just now. Does that mean that the lockdown is also a cause for concern in this context?
It's a huge cause for concern. I'm sure you're aware of, but the social isolation, loneliness that people are experiencing. If people with dementia, and also their caregivers is quite detrimental because loneliness and loneliness is a risk factor for depression. So the mental health impact is huge. Also for people with Alzheimer's disease, they benefit from routine, they benefit from activities, engagement, socialization, and when they're not able to do that, it's very detrimental to their mental and physical well-being, and also causes increasing caregiver burden. So we're seeing this. Interestingly, we're on it was called today with there's a link between the Alzheimer's Society of Ireland are linking in with the Alzheimer's Society in Kenya through GBHI, and there's going to be caregiver training. But one of the caregivers in Kenya was talking about now because people have to wear masks in Kenya. That's for older people. See people with masks, that means that they're robbers, so they get very frightened. It's just interesting how simple as that can have such a negative effect where there is some cognitive impairment. And I guess these are the sorts of things that are happening for people with dementia and their caregivers at the moment. So yes, there is a detrimental effect, mostly in terms of increasing behavioral challenges, but also mental health issues like depression and anxiety for the person with dementia, but also for caregivers.
It's tough times we live in. So Jan is asking, I guess the question, a wonderful question actually, to maybe round up our question and answer session, which is, we've spoken about prevention, we've spoken about potential treatments, but is there any pathway that can be envisaged towards a cure at this stage?
I mean, there are many different pathways being explored towards cure. I mean, we're not there yet. I mean, Alzheimer's disease, as you heard tonight, is a complex illness. I mean, there are typical and atypical presentations. We know a lot about the biology of Alzheimer's disease. So even though for Terry Pratchett it was the back part of the brain, the pathology was the same if it happened in the hippocampus and the temporal lobe, or perhaps more. Sometimes it can happen in the front part of the brain, and so the pathology is the same. We know a lot about the pathology. It's called amyloid. It's an amyloid. This deposition of the amyloid protein. In fact, that was a lot of the research that was funded through his $1 million donation down in the UK. So we know a lot about what happens and what's happening to the brain. There are some, I wouldn't say breakthroughs, but there are lots of treatments now that are targeting the pathology, trying to clear the pathology early on before a lot of damage occurs. It's called the amyloid hypothesis, and these approaches up until now haven't been successful. There's one treatment at the moment that's potentially, maybe partly successful. We don't know. We know whether it's going to go further over the next 3 or 4 months. There are also treatments that are targeting a feature of Alzheimer's disease called tau. So there are lots of innovations going on there, But I think you have to spread the net wide. This is why the work that we're doing with Andrew Harkin in the Institute of Neuroscience, looking at norepinephrine or noradrenaline and the locus ceruleus, this is looking at a particular chemical message, but also looking at it, which is really also very important in terms of what may be going on in Alzheimer's disease. So I think you have to spread the net wide, because if you put all your, you could end up with nothing. So I think we are a ways away from a cure, but we have to continue to do the discovery science. It may be that we will find very effective treatment certain aspects or certain forms of Alzheimer's disease. Just like with cancer, cancer started out as one big thing, but in fact there are many different forms of cancer, and cancer can be now typed down to the molecular level, and I think that's really where we probably need to go with Alzheimer's disease. It probably isn't going to be one specific treatment; it's going to be treatments. But I do think that it isn't just going to be medication or drugs. We have to look at lifestyle. We have to look at public health approach. We have to look at care and caring as well.
A last question has just come in, which was actually one that was asked to me earlier on, and I was not able to answer. So maybe you can, as an expert in the field. What if you know of the work of Li Hui with gamma? Do you have any thoughts on that research?
I think this is the work in mice, looking at these gamma rays can affect amyloid levels. I mean, this is at the basic science level. I mean, it's interesting research. It's well reviewed, peer reviewed, and well respected. So, I mean, these approaches could be of benefit, could potentially benefit. But that work is still at the mouse level, and unfortunately, as has been said many times, we've cured Alzheimer's disease in mice hundreds of times, but we haven't cured it in humans. But you have to start a movie, you translate from the animal to the humans. So yeah, I think it's interesting work.
That's excellent. Thank you so much. It's been really enlightening for me, and I can see comments coming through saying people have got an enormous amount from hearing from you. So that's also heartening for us looking forward to in the Pratchett Project, because there will be more of this kind of talk in the future. And I think this is precisely the way that we start breaking down those kinds of stigma that exist.
Yeah. And again, I think it's bidirectional for me. I think I've learned an awful lot from sitting in tonight. So thank you, and thank Roisin. It was really enlightening for me, inspiring, and I think it's sharing ideas. That's the way to go forward.
Exactly. Okay, so we'll take a 10-minute break or so, and then we'll be back with our final talk on the hour. Thank you again, Brian, honestly.
Okay. Good night, everybody.